This was not easy. You beat a lot of really, really great companies. I actually judged in this round, so I'm familiar with all of you. And let me just say, you're all freaking winners. This end of the day, though, we have to pick one, and that's what the judges are going to do. So we're really going to focus on the questions that we provided that really are just trying to tease out what makes you guys so different. So the first real question is, how do you see employer wellness evolving in the post-COVID era? And what is your company doing to adapt and rise around all this competition? Again, teasing out how you're different. Megan, you get to go first.
Sure. So first, thank you so much for the opportunity to represent GRAIL. We're really honored to be among this amazing group of finalists. So we have a multi-cancer early detection test called Gallery. This is a cancer screening test that really helps employers go further in the fight against cancer. We all know that access to cancer screenings is a challenge for employers, and COVID-19 made that worse. About 10 million cancer screenings were missed during the pandemic, and not surprisingly, almost 60% of employers anticipate or actually already seeing an increase in late-stage cancer due to these delayed screenings through the COVID-19 pandemic. Also, cancer is now the #1 driver of healthcare costs, so very top of mind. And some might not realize that late-stage cancer actually drives more than half of those cancer-related medical spends. And in fact, more than 80% of cancer claims above $100,000 are for cancers that don't have a recommended screening test. And that's where Gallery comes in. So we screen for 5 cancers right now. That's it. Gallery is a multi-cancer early detection test. It's the first test that is capable of detecting a shared cancer signal across more than 50 different cancer types. And it predicts where in the body that cancer signal is coming from. And it does this with a simple blood draw, which can be completed from just about anywhere in the US through employer-sponsored events on site, through an employee's home and mobile phlebotomy units, for example. And one of the really differentiating things for GRAIL and for the Gallery test specifically is that we're really the only pre-diagnosis solution that can find that signal for cancers that have no other screening option and help get patients into care at earlier stages before they are symptomatic. Good. When we know outcomes are better.
Okay, great. Super tight. And Chiara, Care Heroes, and I know everyone loves the name of your company the most. You get to go next. Why you guys?
Hi. It's an honor to be here. My name is Chiara Bell. I'm the CEO and founder of Care Heroes. We are an incentive platform for anybody delivering care in the home. So we work with the workforce, whether you are a nurse practitioner, a nurse, licensed nurse, CNA, or companion aid, or a family member. Everyone talks about value-based modeling of care delivery. How about taking that model and applying it to anyone who's touching patients in the home? So we work with home care agencies, skilled nursing facilities, family members, and payers, and we connect with the caregivers. They report back the care they're providing, and they earn incentives for providing quality outcomes and care to the workforce. So we believe that COVID actually, I always say it took a pandemic for people to recognize the power and importance of the home care delivery system and the workforce that's providing care in the home, especially family members. So think about a family member earning incentives for taking care of mom and dad in the home, just as the physician or a hospital would.
Excellent. That's tight. Sara, you get to go next.
Thank you. It's an honor to be here amongst the other finalists. I'm Sara Izadi, happen to be a UCSF alum, but also the Chief Clinical Officer at Capital RX, pharmacist by training, and have been in this industry for over a decade. Capital RX is a fastest growing pharmacy benefit manager in the country, covering about 2.5 million lives going into 2024. We are a full service pharmacy benefit manager and administrator, leveraging our technological capabilities, most notably our pharmacy enterprise platform, Judy, to tackle really one of the biggest challenges in the industry. And that's humanizing the pharmacy benefit space and putting the employee and the patient at the center of it. So we know that the rising cost of prescription drugs is a concern. It has been pre-COVID. What we're seeing post-COVID is increased utilization, particularly in the chronic medication space. And what we're seeing with that is lots of point solutions aimed at this and home-centric care, as I believe some of the other finalists have touched upon. What we're doing is we're bringing a fundamentally aligned model to this space, leveraging both Judy and our care model to ensure that patients and employees are really at the center of care. So how do we do this? Several ways. We ensure that there is no pricing disparities at the point of sale when the employee or the patient standing there at the pharmacy through duty. We integrate with multiple point solutions to remove roadblocks for employees, ensuring a cohesive experience. And we also have clinicians at the center of our model. Judy allows us to do that. And we have the results to prove it. We have member NPS scores of above 90%, client satisfaction scores of 95, and have increased adherence across the board.
Excellent. That was fantastic. Naomi, you get to go next.
Great. I'm Naomi, Chief Growth Officer for Reperio Health, and we are a provider of at-home and on-site comprehensive health screenings with instant results. What we do for employers and wellness providers is we provide a patented screening kit that arrives to an employee's home where they pair our kit with a mobile device that gives them access to key health indicators, gives them instant cholesterol, glucose level readings, their blood pressure, all in less than 30 minutes. And the reason why this is so important for employers, especially in our post-pandemic world, is that before a kit like this, there were no solutions to provide biometric screenings when we couldn't have people co-located together. So we really are the very first remote and consumer grade kit that can be used by employees, whether they are in an office space or they're in the comfort of their own home.
That's great. And that's couldn't be any tighter than that. Thanks, Naomi. Christopher, your turn.
Thank you for having me. My name is Christopher Lucas. I am the CEO and co-founder of Ompractice, a digital well-being platform that takes the technology of today, just like this, and marries it to traditional wellness practices that are often overlooked, but have a ton of evidence base. And we make them available and accessible for people of all life experiences. And so what that looks like for us is working with large employers that have a lot of population health, specific population health objectives. And while we were very well situated for the COVID era, we're even better for the post-COVID era because employers are looking at people specifically. They're not looking at their employees like a thing. They're looking at their employees as people. And those people have very specific needs, both collectively and individually. And instead of taking our product and saying, hey, maybe this will work, see what happens, we actually at scale can work with employers to address very specific population health needs that they have at their company, or as we do across the VA from San Diego to Boston. We're looking for outcomes that are of interest for employers, and we drive those outcomes through our platform.
Fantastic. Okay, Dr. Mistry, you go next.
Thank you. Thank you for considering us for the finalists. So I'm Dr. Bipin Mistry. I'm Chief Medical Officer at Alight. So, at Alight, we're in the business of powering confident decisions for life. We have a leading cloud-based human capital technology and services provider. We try to power confident decisions in health, wealth, and well-being decisions. And we touch, 36 million people and their dependents already. What is unique about us and how we're positioned is that we provide the only integrated solution that addresses every key healthcare decision an employer will face, from being hired through retiring. And we've seen that in the pandemic and post-pandemic era. It's really important to sort of drive value at the employee level, which ultimately derives value at the employer level. And we offer a really sort of comprehensive approach to well-being in the market with a deep portfolio of products and services. And we work in harmony to create that sort of concept of healthy minds, healthy bodies, healthy wallets, and healthy lives. And the way we look at things in terms of a employee journey is around moments. And so there's everyday moments. So typically a healthy new hire, they need to understand their new plans, what's their benefits, etc. But we also look at moments of opportunity, where we look, someone's looking for a doctor or getting connected to the right well-being solution. And we're also there for the employee when it's the moments of acute need. So if there's a new medical diagnosis, they need clinical guidance with unbiased information and trusted navigation without disrupting the health plan ecosystem. And so that's how we sort of differentiate ourselves overall. We also use our platform to help drive engagement. We use AI personalization, and typically we have about 22 interactions annually. Collectively, we've had over 200 million interactions annually across our portfolio. which really gives us that unique lens into how to drive engagement and drive people to the right solution at the right time.
Great. Fantastic. All right, Raja, you get to go next for Plethy.
Hi, everyone. I'm Raja Sundaram. I'm the CEO of Plethy. We're a musculoskeletal care platform, but we focus on injured workers and their recovery. So you want to think about it as agricultural, oil and natural gas, mining, the lunch lady of your kid's school, and so on. And our real emphasis is between clinic visits, we're not a replacement to something, enable the patient to manage their care at home and recover quicker, faster. We're clinical in how we approach it. Now, what changed post-COVID is this. Employers want the employees to return to work. They want to keep their employees. It's hard for them to find replacement employees, which means to us, the directive is if the employee has got a medical-only claim, keep it medical-only so that there is no lost time. If it goes into an indemnity claim, which is lost time and therefore 67% of payroll, then get them back to work quicker, faster. For example, if it is a knee or a knee replacement or an ACL, MCL, we've been known to return to work, workers to return to work 25 days earlier. Each day matters. And that's really what we are. Thank you for the opportunity.
Great. Fantastic. Let's see who gets to go next. All right, Shireen from Yumlish.
Sure. So Mark, I have a question for you to which you have to say yes for this to work. Okay. All right.
You know,
Perfect. All right, Krista. So Mark, do you do your grocery shopping and have you ever purchased an item that says all natural on it, thinking that it is healthy for you?
probably this one. Can you
There
see
you
it?
go. Okay. So the answer is yes. Perfect. Thank you so much. Did you know, Mark, that actually all natural doesn't mean anything. It doesn't equal healthy. It doesn't mean anything at all. It is an overused term that is unregulated and undefined. But turns
That's
out you and I, Mark, are not the only ones that gets burned by all of these packaged, things on there. But it turns out that 78% of consumers report conflicting information about what to eat and avoid. And over half of consumers aren't able to identify a single food with a health benefit. And that is exactly what we do at Yumlish is we are scaling nutrition education and exercise competence in a way that is accessible and engaging in underserved communities. So we combine nutrition, exercise content, really think of it as YouTube for evidence-based information, combine that with tech-enabled workflows and one-on-one guidance from a nutrition expert. And that really sits at the heart of the work that we do. And my own core experience of years ago being told to eat healthy after a chronic condition diagnosis and just not knowing what that meant for me. At Yumlish, our digital health platform is important for employers because it helps to improve not only the health and well-being of their workforce, it reduces the healthcare costs and really fosters cultural competence, which is core of the work that we do, enhancing employee engagement and also retention to really support preventative health measures.
That was great, and I will put my Martinellis aside. Okay, Brent, you go next.
Excellent. Thank you, Mark, and it's good to be with you all today. I'm Brent Nicholson, co-founder and chief partner officer at Carrum Health. And what we're seeing out in the market, in the employee benefits market, is two things: the proliferation of point solutions and intensified cost pressure. And so on average, employers have 16 different point solutions, so they're overwhelmed with vendor management and cost pressure coming from the macroeconomic environment and the crushing weight of expensive conditions like cancer and MSK, where a small amount of claims, less than 10% of claims, actually generate over 50% of costs. And you add to that the post-COVID era, which brought us a backlog of surgeries and delayed cancer screenings. And so employers no longer have the luxury of time and money to have a portfolio of numerous solutions that deliver soft and future benefits. And so as employers are becoming more demanding and discerning around hard dollar savings and ROI, we're seeing a rising interest in centers of excellence, or COEs, where at Carrum, we use a rigorous quality evaluation methodology to find the top 10% providers, and then we contract with them for an all-inclusive, transparent bundle price for surgical and cancer treatment. And we align incentives and create real value-based care because each of our bundles that we contract for have warranties. So providers are actually taking on risk. And so the business group on health, shows that over 90% of employers are now using a COE in at least one condition category. And in cancer and MSK, that's set to see double-digit growth within the next year. And Carrum as a solution has been validated to have real meaningful savings. The RAND Corporation ran an independent peer-reviewed study that showed 30% surgery avoidance, 80% reduction in readmissions, and 45% unit cost savings. And so as employers are looking for more tangible and immediate savings rather than kind of theoretical or soft savings, we think that makes the difference in this new era.
Fantastic. That's great, Brent. Katherine, you get to go.
Great. Thanks so much, Mark. We're really excited to be part of the awards again this year. And thank you for having us. I'm Dr. Katherine Saunders. I'm an obesity medicine physician and co-founder of Intellihealth, where we're scaling medical obesity treatment. So as I'm sure everyone is well aware, almost 80% of the country has overweight or obesity. We finally have highly, highly effective medications, but we're in a situation where only 2%, maybe 5% at most of the population is receiving medical obesity care according to guidelines. And this is for two reasons. There are too few providers. I'm still one of 130 fellowship trained obesity medicine physicians in the whole country. And two, obesity is really a whole specialty. It's not just to see a patient and prescribe one expensive GLP-1 receptor agonist. And so what we have with our company is the ability to take the very, very, very high level of compassionate, effective, and cost-effective care that we've perfected over decades at Weill Cornell Medicine, and we can scale it. And we're focused now on the employer space. With the pandemic, we really saw that at our weight center at Cornell, where we went from 100% in person to 100% virtual overnight, we were able to get just, the same outcomes or even better outcomes, and patients were so much happier doing everything with telemedicine. So we have a software platform that trains providers and provides everything necessary to provide high-level care. And then we also have telemedicine services. And in the employer space right now, employers are freaking out about how to cover anti-obesity medications without going bankrupt. And the answer isn't just saying, no, we're not going to cover. The answer really is, yes, we can cover, but with guardrails. And so what we have is the ability to provide a very, very, very high level of medical obesity treatment with those guardrails so that we don't, have companies go bankrupt. Our latest partnership is with a large state government. It's an exclusive contract with the state government. And we believe that this is going to transform in the employer medical obesity space. So our superpower is that we have the best expertise in terms of our medical team. We have award-winning software, and we're able to really, show years and years and years of excellent, excellent results, happy patients, and cost-effective care for our customers and employers.
Fantastic. That's we know obesity is right up there, and I know what you guys are doing is amazing. Nurdin, you get to go next.
All right. Thanks so much for the opportunity of being finalist, and thanks for the team. My name is Nurdin Bukhari. I'm the founder and CEO here at Nytia Labs, newly Nytia Health. What we do at Nytia Labs is we work towards lowering the impact of chronic conditions at workplaces, and businesses across North America, especially in US, for example, businesses lose every single year $425 billion every single year to productivity because of chronic conditions. Here in Canada, it's $122 billion. We use what we provide to employers and their employees is a tool for employees to collect, to use their data, their diet data, their family history, their genetics data, their sleep data, and more other useful data to predict the best we can the chronic conditions they are the most at risk at, and provide recommendation for them to maintain a healthy and productive life. For their employers, we provide a community health insights tool they can use to be guided through their workplace wellness policies change. We also provide them a clinical validation tool they can use to see clearly the the impact we're having on them. Thank you.
Okay. Great. And put that, get your background images up so the judges know who you are. Because right now you don't have your background image on. Did I get everyone? I think I did.
Nope, you missed Osara.
Osara, how could I do that? All right. All right, go for it. It's all you, Chris.
Yeah. Nick. So, hey everyone, Nick Tillman with Osara Health. I'm the head of business development. At Osara, we're an evidence-based solution supporting and transforming the way that care is provided for people that are living with cancer, as well as their caregivers. So the way that we do that, it's an app-driven program that's supported through a 12-week program with both our coaches and our on-staff oncologists to do symptom tracking and management, focus on exercise and metabolic health, as well as sleeping patterns and overall mindfulness. And with this, we're seeing really good outcomes in all those areas. We have great outcomes as it pertains to return to work and overall productivity, ultimately driving down claims costs with about a 7-to-1 return on investment.
Excellent. That's great, Sara. All right. So we've got everyone. I've gotten everyone now, right? So now I'm going to split you guys into two. Remember, we have two types of awards here. We have our best of class awards and we have our rising stars. And I'm going to focus on the best of class guys. And when we're done here, you guys can actually leave. The best of class winners, it's Alight, it's Capital RX, it's Carrum, and it's GRAIL. Now, okay, I'm a judge. I've just gone through your pitches. You guys are all doing incredibly important things. So I'm going to challenge you now for 30 seconds each and tell me why for 2023, what it is you're doing, given our post-COVID world, everything we've talked about here, why what it is you're doing should absolutely be the number one thing that they should be voting for this year. Because all of what you're doing is amazing. But I want you to really tease it out. So who gets to go first? Capital RX, because I know it's going to be easy for you to tell the story.
No problem. So how good are solutions if they don't fit the existing infrastructure of our very complex healthcare system? And at Capital RX, we leverage Judy, which is our enterprise pharmacy claims processing platform we built internally to bring everything together. So really, what does that mean? We talked about GLP-1s being a hot topic right now, projected to cost about $100 million by 2030. How do we leverage Judy to remove frictions? We have point solutions, they work. At Capital RX, we bring it all together. Through Judy, we're able to do several things. We're able to integrate so that members are getting formulary or benefit aligned elections, removing roadblocks from them at the point of sale or at the pharmacy counter. We're able to integrate and bring together pharmacy and medical claims via Judy to identify opportunities for seamless referral to such point solutions, as well as on reporting of outcomes of these employees to their employers. We also have a clinician-led model that puts the patient at the center of our care to ensure that they're adherent with these expensive treatments. So really, it's Judy leveraging us to maximize our clinician-led model. We have outcomes to prove that Judy works for us and that plan sponsors are happy. Of course, in the case of GLP-1s, it's too early to tell, but we know that, for example, patients regain their weight when they come off of these medications. And through our initiatives, we've shown that compared to what we're seeing in the market, patients enrolled in our program and part of Judy are able to maintain their weight loss. And we've shown adherence through Judy in our care model. So really our differentiator would be that we, as the basic building blocks of our already established healthcare system, leverage Judy to ensure efficiencies and a good employee experience.
Okay, so bringing in incredible efficiency, and which is obviously what the healthcare system needs. Okay, shifting to cancer and more, GRAIL. Let's hear it. Let's give us your 30 seconds.
Great, thank you. So across all of our channels, we have engagements with employers, with payers, with life insurance partners, with health systems and private practice. We've delivered over 100,000 Gallery test results in the real world, including a large proportion from our employer partners specifically. And this includes large employer partners like Paramount, Salesforce, and Intermountain Health. Modeled data shows that adding Gallery to the recommended screens, which again, we only have for 5 cancer types, that employers could potentially see up to a 50% reduction in late-stage cancer diagnoses, and that would translate to a 21% reduction in medical spend on metastatic cancer treatment alone. Again, we're only screening for 5 cancers. Galleri is the only multi-cancer early detection test available that can detect a shared cancer signal from over 50 different types of cancer from a single blood test. This is how we are going to win the war on cancer. We strongly believe that Galleri is a critical new front in this war on cancer that can finally bend that cancer mortality curve. We've seen strong engagement across the health benefit spectrum, open enrollment. We do integrated campaigns with the employer's medical carrier, on-site events through health fairs and internal communications on message boards, intranet placements, corporate emails, and we have great success with employers who are really focused on a long-term partnership and who advocate for the Galleri test, working together with them as we launch and communicate the value of the test and use relevant moments like Cancer Awareness Months, key benefit communications and on-site events to drive ongoing and sustainable engagement.
Okay.
I just want to point out really quickly that this is also viewed as a huge ROI for employees. Galleri was ranked on par with a salary increase as the most important health benefit that you can offer. And in a competitive talent pool, that's a really critical finding.
Well, I love how you ended that. So thank you, Megan. It's powerful.
Thank you.
Carrum Health, it's your chance.
All right, thanks, Mark. Well, at Carrum Health, we believe that the biggest villain in the U.S. healthcare system is actually the payment model. So, we can continue to, throw more technology into healthcare, but if it's on top of a broken business model, it won't be nearly as effective. And so we founded Carrum to catalyze the adoption of more value-based care, and our solution offers a different way to pay for healthcare based on volume and not on volume. We align incentives around the appropriateness of treatment. And in our model, providers are actually taking on accountability and downside risk. So it actually changes the way that they practice and deliver medicine. And so why is this important now, in 23, heading into 2024? We're seeing a bit of a paradigm shift in how employers approach health benefits, partly due to that macroeconomic cost pressure, partly due to the availability of more data and information, but a shift from, ultimate choice and optionality where, you send your employees out to go figure it out, and then we'll share in the cost of the consequences of where you go get care, to a model where it's, employees are saying, tell me where to go. And then if you go, to the best place to get care, the employer then pays for the care in a value-based purchasing and delivery model. This is exactly what Carrum does, to do all the homework, to rigorously vet the providers, negotiate the all-inclusive transparent bundle prices, and then just make it as seamless and simple as possible for employers and then patients to use this model.
Fantastic, Brent, good job. Alight.
Thank you, Mark. So, employers have had to invest in a lot of solutions, and what we do is we make our clients better by improving the employer's health and well-being. So we help support all unique health and well-being needs of today's diverse multi-generational workforce. And what we try to do is optimize utilization of their health benefits in a way that is measurable, both in terms of lift and the value created for the organization and we put our fees at risk for this. Some examples of what we do is ecosystem optimization, for example. Everyone's talked about point solution fatigue. What we try to do is sort of optimize it for the employer's needs. And what we've seen is a 10% increase in utilization of these point solutions and well-being solutions, and net savings on an annual basis for the employer. We've also helped improve employer productivity by reducing, by increasing we've saved over 100 minutes a day on average, and 17.5 days in reduction in lost work days. With our healthcare navigation, we've seen some huge savings, on average about $5,200 per case. We provide that medical decision support, healthcare literacy, and so forth. Net, we have shown better outcomes for employees with unbiased information, improving healthcare literacy and trusted navigation. And ultimately, it's savings for the employee and savings for the employer.
Perfect. So I think what we're leaving it to the judges are going to basically look at 4 incredible problems, one of which is, winning the war on cancer, a roadmap to value-based care, efficiency, basically getting to with duty efficiency care models, and we're basically running more efficient. And then at the end, Bipin, with you, this is basically is really optimization. And what are you paying for, and how are we squeezing the most out of it? Very almost looking at the, it's almost the opposite of duty, sort of like both sides of it. One's looking up, one's looking down. These are huge problems, guys. I think this is going to be really helpful for the judges. The 4 of you can go. Thank you, thank you, thank you. Best of luck. You're all freaking winners, no question. And have a great rest of your day. So now we'll get to the rising stars. So you guys, it's a little different, but I really liked how that worked out. So we're gonna riff it a little bit. But I want you all to close your eyes and think in 3 to 5 years. And so I'm a judge, and when I'm basically choosing for one of the rising stars, you are the, you're the rising hope. You're the next great companies. Why in 3 to 5 years, what you're doing today, are you absolutely a best in class in company? And why is this one of the most important things you guys are doing for healthcare? You've got, up to 8 companies here. You got 30 seconds. And I really want you to think 3 to 5 years out, what it is you're doing. So if I were a judge, I'd say, oh, good. I understand why I have to vote for you. Okay. Whoever gets to go first, it's completely unfair. So I know someone's really smart. So Katherine, you're going to get to go first.
Thank you, Mark. I'm excited to go. So obesity is the hottest topic right now. We finally have highly, highly effective medications, but the cost is way too high. We don't have enough providers and coverage is just not good enough. At the same time, employers have no idea what to do because they're facing bankruptcy if they cover anti-obesity medications, and several government organizations and companies have actually rescinded coverage because of overspend. At the same time, employees are demanding and even suing for coverage. So this is a huge, huge, huge crisis that needs to be solved now and is not going to go away in the next several years. Intellihealth is the only solution out there that combines deep, deep, deep expertise, decades of published research, and the best software to provide the highest level of compassionate and cost-effective care. So employers can't keep saying no to employee coverage because of med prices. They need to offer a solution to their employees now. And for the next several years, we have about a decade before the drug prices come down. So needs to be solved now.
Good. As opposed to just dishing out $10,000 worth of pills and sign up to your program. And that's where we know this is big. Okay, Nick, you get to go next.
Perfect. So I guess my answer to this is, solutions are only as good as the awareness that you can build around them in the market. So if I look at Osara Health through the lens of a benefits leader, we all know that cancer is the #1 cost driver for healthcare costs. Not only do we drive down those costs with a 7-to-1 return on investment, but we also have a holistic approach that supports, people that are living with cancer and their caregivers. So we've seen over 50% improvement in mental health, physical health and symptom management, reduction in fatigue, and also return to work is a big area where we support and have great outcomes. So in comparison to, the control group that doesn't have access to Osara, we're getting people to return to work 16 weeks earlier. These outcomes are all published and peer reviewed, and we happen to be the only solution in our space that can say that.
All right. Well, return to work, that's pretty big. Okay, Raja, your turn.
Hey, look, musculoskeletal care is, the need is increasing. We're all growing older, living longer. And access to care continues to be a big issue. So if we forward look 3 years from now, in this space, we're the only company who's selling into orthopedic groups, spine groups, pain groups, and health systems, and also doing workers' comp, right? And it's a combination of health, group health, and OC health, right? And so I think the opportunity for us in that is understanding that a human being, a patient or an employee, the recovery is not a straight line. What makes us pretty unique is it's not about the tech. We realized very quickly it's not the tech. It's about how we engage patients. So we have a biopsychosocial program that in healthcare is driving 75 to 83% engagement, and in workers' comp driving 65% engagement, which is, I think, what is going to differentiate us. It's not the tech, it's not the AI model, which we all have. It's how you engage patients. And in this space, that's how we're going to differentiate.
Okay. Okay, Shireen. Yumlish.
Yes, of course. So from my perspective, I really believe that the reason why this is so important today is because we just can't lead with chronic condition management anymore. I think it's a model that has sustained us so far, but will not guide us going forward in a sustainable way. We provide at Yumlish, we provide fully competent nutrition education delivered in a low tech, low literacy way, not that YouTube for Nutrition model that I mentioned. We're really about lowering the costs of providing that care by eliminating even remote devices. Again, it's not about the technology. It's not going to be about another app. It's not going to be about another device that you can connect to. It is truly, the bottom line is, it's about empowering the employee to make better nutrition and health choices for themselves in a manner that is most relevant to them.
Good. Okay. Well, that's pretty damn compelling. Okay. Oh, Navadine, you've got a background now. It's all you.
Yeah, as I've said earlier, the economic burden of chronic conditions on our economies, especially in North America, is really important. And both governments spend in between 80 to 90% of their total investment into healthcare fighting chronic conditions. And businesses are losing a lot of money. So that's why we use a perfect combination of AI and machine learning algorithms, well-established evidence-based models to be able to lower that economic burden, and also really empower the employees through an efficient combination of the services we're providing through our nutrition solutions, chronic conditions prediction, lifestyle assessments, and many other features, including virtual care.
Fantastic. Did I get everyone? I think so.
Reperio hasn't gone yet.
Oh,
Mark.
no,
Same with Ompractice.
Oh, look at that. I'm just run for the gate. Okay, Naomi, you get to go first.
Awesome. Well, when we consider the impact that Reperio Health can make for employers and healthcare over the next 3 to 5 years, there's really 2 reasons why we should win the Digital Health Awards Rising Star for Employer Subsidized Wellness. And the first is our technology. We developed an elegant, thoughtful consumer experience in one kit that combines this variety of medical devices without having to individually pair your smartphone to each and every one of them. Our tech also delivers immediate results. There's no lab that you have to send your information out to. And the second reason that we should win is the set of value propositions that our data delivers to employers. And there's 3 of them. Employers get to better engage their employees in their health. Our provider ecosystem is constrained. It's hard to get in to see your provider. Second, the data that we provide helps you to tailor your wellness programs so that you know what trends will impact your workforce health. And then most valuably, the aggregated data that you receive from Reperio Health for employers helps to negotiate the best insurance rates possible. Thanks, Mark.
Great. Okay. Chris.
All right. Well, thank you again for the opportunity to be among this incredible group. I believe Ompractice was onto something much earlier than everyone thought, and we still see a fundamental misread in the market, particularly when it comes to well-being, where things that have actually been very effective for a very, very long time continue to be effective, and they will be in 3 to 5 years. So the question, does this work, isn't actually a question that we need to have anymore. So for us, we look at this as, how do we go from a benefit mindset into we are a bridge to a better life. And 85% of our users report feeling happier, healthier, stronger, less anxious, and over a third are sleeping better. And so we already know that the impact is there. And so for us, we believe in growing both our footprint from 1 in 10 veterans in the US to 10 out of 10, as well as working with employers that are looking for a solution that speaks to multiple populations, multiple issues like obesity, like cancer, in ways that both work for the person as a human and does not feel prescriptive, like they're trying, like the person or like the employee is a problem. The employee is a center of excellence, frankly, and we want to make sure that they feel like they're thriving and living their absolute best life that they can.
All right, Chiara, go.
So I'm going to give you a couple of stats of why Care Heroes should be selected as the winner of the Rising Star category. There's about 90 million people covered on Medicaid today, whether it's through managed Medicaid or straight Medicaid. You've got your extraordinary growth in Medicare Advantage, and you only have right now about 1.9 million caregivers who are delivering care in the home to support everybody who is receiving care. We don't know who they are. We're not incentivizing them. We're not recognizing and we're not supporting that workforce. It's expected that you're going to have an extraordinary shortage of that workforce by 2030. It's estimated to be anywhere between 900 to 1.2 million folks. And you've got 50 million unpaid caregivers that are taking care of family members. So when you look at all those stats, think about being able to now drive an incentive and wellness model for every single one of those workers who's touching patrons and encouraging them and rewarding them for providing quality care at home. So it's a crisis that our country is facing that hasn't looked at, but we're going to have to do two things. We're going to have to take the current workforce and support them in very, very different ways. When you think of training, professional incentives, and earning wages that are living wages. And two, you're going to have to supplement that workforce really with family members who've been clinicians on their own because no one else has been able to take care of their loved ones. So that's what Care Heroes does, is building a next generation incentive model for that workforce.
Perfect. That's great. So we've talked about ranging from, returning to work faster, obesity, MSK recovery, bad food, bringing on the caregivers, communication system, facilitating Medicaid. I mean, better diagnostics. These are all really important programs. It's going to be up to the judge to figure out which three in 3 years are even going to be more important, right? You want to, as Wayne Gretzky said, you want to basically go where the puck is going. That's what these judges are going to do. They're going to say, where are these companies? And in 3 years, what is that much more important? I think we've had a great panel here. I think we've captured what it is we needed to do. Guys, thank you. This was great. The judges will appreciate it. Best of luck. I will be hopefully seeing most of you in Las Vegas. It's going to be a great show. It's already sold out. We're dealing with it. And but it's going to be fun. And 3 of you are going to go home with your, here's mine, your digital healthy baby. And so have a great rest of your day. And thanks for this. It's very helpful. I really appreciate it.
It's great. It's an honor to be a part.
Thank you, Mark.
Thank you.
All of you guys.
Thank
you.
It's a whole team. Thank you.
Thank
Congrats,
you.
everyone.
Despite waging the war on cancer for more than 50 years, we still lose more than 600,000 Americans to the disease every year. This is in part because while early stage cancer has better outcomes at lower treatment costs, we only have recommended screenings for 5 cancer types. To address this unmet need, GRAIL was founded in 2016 with a mission to detect cancer early when it can be cured. Our first product is the Gallery Multi-Cancer Early Detection Test, a single blood test that detects a signal shared by more than 50 cancers, more than 45 of which have no recommended screening in the US. This technological breakthrough is our superpower and could have significant implications for early cancer detection, including for self-insured employers. A commercial claims analysis showed the Gallery potentially detects up to 98% of diagnosed cancer types in a typical employer population. Model data also shows that adding the Gallery test to recommended screenings could result in a 50% reduction in the proportion of cases diagnosed at stages 3 and 4, and a 26% reduction in 5-year cancer-related mortality. We were recently recognized by both Time Magazine and The Atlantic as one of the top technological breakthroughs of the year. We've provided over 100,000 people with test results, and we are detecting signals in many cases at early stages and in deadly cancers that have no other mechanism for early detection. Winning a 2023 Digital Health Award would be an incredible honor for both GRAIL and for the more than 50 innovative companies offering the Gallery test. And the Gallery test could be that new front in the war on cancer.
Carrum Health is focused on shifting healthcare from the antiquated fee-for-service model to value-based care and disrupting how we pay for and deliver care. We are a complete surgical and cancer care platform. Quality is our North Star. We've curated a Centers of Excellence network comprised of the nation's top 10% of musculoskeletal, bariatric, cardiovascular, and oncology professionals and facilities. We'll apply our predictive algorithms to specifically speak to that small percentage of the population that is driving that large percentage of spend. We focus on getting that member to Carrum quickly and efficiently.
We have a proven playbook that we have developed and evolved over the years to drive meaningful levels of engagement in the program. It's really all in the spirit of making this decision to come use a Carrum Health Center of Excellence as easy and as simple as possible. Over the years, we've developed predictive analytics that are powered by machine learning to comb through medical claims data and be able to pick out the indicators or precursors that a member might be trending towards one of the procedures or conditions that we offer through the program. We want members to feel like as they're going through the Carrum Health program, they have someone with them holding their hand every single step of the way. And we accomplish that through a combination of human support. This is our dedicated patient care specialist team, but then we elevate that experience using modern technology tools.
For the patients, there are little to no out-of-pocket costs. So we're emancipating them from that financial toxicity while giving them the very best of the best. And for the employer, we're really providing them with the opportunity to save on an episode of care.
I'm AJ Loyakino, the CEO and co-founder of Capital RX. We are a PBM, a pharmacy benefit manager, and we service employer groups directly. And we are a PBA, a pharmacy benefit administrator, where we provide technology and solutions for health systems and health carriers. Our mission is to change the way drugs are priced and patients are serviced to create enduring social change, because every American will fill hundreds of prescriptions over the course of their life. To reduce prescription costs in the United States, it required two initiatives from our organization. The first was to create a public ledger for prescription transactions. We call this a clearinghouse model, where we allow the buy side, the employer and patient, and the sell side, the pharmacies, to freely communicate on price. We do this with a flat administrative fee, and we do not encumber prescription prices. This means every patient and plan receives the same price, but more importantly, we deliver it through an agnostic network of pharmacies. So retail, mail, pharmacies across the United States, including health systems, can freely participate in our network model. We deliver this model through a modern administrative platform. We call this Judy. Judy is short for adjudication, and she's the brains behind our organization. The systems of the United States that are running prescription transactions are 20 to 30 years old and have traditionally only addressed the thin middle layer of processing claims. Judy is a true enterprise health platform and contemplates every workflow a pharmacy benefit administrator must contemplate, from underwriting to plan setup to claim processing to drug utilization review, clinical workflows, as well as network administration, billing, and reimbursement. By doing this, we're able to reduce costs for our customers by over 80% on the administrative side, and this means lower cost prescriptions for the patients in the plans.
Alight is a technology and services provider that serves over 70% of the Fortune 100 and over 36 million employees and family members. We are tackling holistic employee well-being in ways that no others can, helping people make confident decisions for healthier minds, bodies, wallets, and lives. Our platform, Alight Work-Life, facilitates over 200 million interactions a year. I'm here to share with you our newest offering, Alight Work-Life Health. It is the only integrated program that addresses every key healthcare decision your people will face, from being hired through retiring. Let me elaborate. Until now, organizations have needed a myriad of products and strategies to address the health and well-being needs of today's multi-generational workforce. Alight Work-Life Health simplifies this equation for organizations, and it increases savings and delivers value at every stage of the journey, from health plan enrollment to optimizing care to managing costs. How, you may ask? It brings together our award-winning suite of solutions for navigating and administering healthcare and delivering high-touch clinical expertise unified on the Alight Work-Life platform and integrated with any other health benefits. We can help organizations achieve this streamlined approach. On average, things like a 30-point improvement in retention, 88% improvement in clinical outcomes when working with our medical ally team, and better engagement, on average over 22 interactions annually per employee on our platform. All in all, happier, less stressed employees that feel cared for. So what is our superpower? Alight's integrated solution that runs across health, wealth, and well-being puts us in the category of one. Our Alight Work-Life platform senses employees' key wants and needs with more precision by applying our data and AI. We see employees in the context of life's journeys and moments to help them navigate healthcare, and we support employees with seamless personalized guidance to optimize their health and well-being. I believe that Alight should win because we are best positioned with our technology, solutions, and scale to help today's diverse workforce make more confident decisions for their holistic well-being every day and in the moments that matter the most.
Hi, I'm Chiara, CEO and founder of Care Heroes. And the mission of Care Heroes is to recognize and support family members who are providing care to their loved ones at home. The best way to describe Care Heroes is to talk to someone who's actually experienced it. My mom, who had significant open heart surgery last year at the age of 81. Mom, why don't you tell us how family members helped you?
My family members saved my life. They were with me, they protected me, they took me to doctors, they fed me, they helped with physical therapy, and they just actually, if it weren't for the fact that I had them, I would have probably ended up in a nursing home or a recovery place that's not as safe, because my doctor insisted that if you stay home, you get better faster. And I certainly did with my family's help.
And that's what we want to do at Care Heroes, is recognize every family member who's coming in and helping their loved ones stay home, out of the nursing home, and safe, especially after they have a significant event like open heart surgery. And my mom today is swimming in the ocean.
Yep, I'm swimming in the ocean, walking and junking and doing the whole 9 yards. I walk as many miles as I can. It started out where I couldn't walk at all, and now I'm around the lake, which was a mile. So I've recovered, and thank you for my family, because if it wasn't for them, I wouldn't be alive today.
Hello, I'm Chris Lucas. I'm the CEO and co-founder of Ompractice, a digital health and well-being company that combines the power of today's technology with traditional wellness practices to deliver over 100 live virtual yoga, tai chi, meditation, and other evidence-backed classes every week that work for all ages and life experiences. Our superpower is creating transformative connections with our users and customers. We partner with major healthcare providers like Harvard Pilgrim Healthcare and complex health systems like the VA from San Diego to Boston. In fact, today, 1 in 10 veterans who receive their healthcare through the VA enjoys free, unlimited access to the Ompractice platform to not only decrease stress, anxiety, and isolationism, but to improve mobility, balance, and mental agility. But what truly sets us apart is not just the accessibility and diversity of our classes, but our camera-on approach. And this strategy, backed by a dynamic and diverse instructor community, engages those who typically have felt left out of these kinds of practices. And the impact is an impressive 90% completion rate for our classes, which translates to substantial physical and mental health benefits for our participants. We believe Ompractice can win because our users are already doing so. More than 85% of Ompractice users credit Ompractice specifically for feeling happier, healthier, stronger, and over a third report improvements in their sleep patterns. So we're not just adapting to the digital era, we're leading within it. We're extending lifelines of wellness and longevity to teams and individuals irrespective of age or location. So Ompractice isn't just about general well-being, it's about building a bridge to a better life.
Poor nutrition is the #1 cause of illness in the United States, and is responsible for over 500,000 deaths a year. The economic cost is $16 trillion, or 9% of GDP annually. In response, physicians are asking their patients who have nutrition-related chronic illnesses to, quote, eat healthy. Sure, how exactly do they do that? Go to the App Store today and browse through all the weight management and disease management apps, and you will soon realize that they're largely used by white, wealthy, educated individuals. That's where we came in. We looked at evidence-based programs like diabetes prevention program and diabetes management program and focused on populations that needed it most. Starting in the Latino community right here in Texas, we took a user-centered approach and created a culturally competent program adopted in an app-less and deviceless approach, delivered entirely over web and text. And it worked because we saw weight loss at about 1 to 2 pounds weight loss per person per week. We also saw a reduction in A1Cs, but more importantly, we realized that we were able to create 12.5 virtual touch points per person per week using this approach. However, this is a two-sided problem that focuses on the disease stage, which then takes us to problem number 2, which is to say that while there's incredible demand from people for nutrition-related services, dietitians on the other hand, and educators on the other hand, aren't able to service the demand due to low reimbursement rates from health insurance that are disease-specific, as well as static delivery models. Now the answer, a nutrition health platform that connects patients and dietitians in a subscription-based model. It looks at nutrition health, not only just focus on disease management health.
My name is Dr. Raghav Murali-Ganesh, and I'm the CEO and co-founder of Osara Health. Over the years, we've made great strides in our mission to improve cancer care. While clinical care is essential, we believe that patients need more than just medical treatment to thrive. They need holistic, patient-centered care that addresses their physical, emotional, and practical needs, which is particularly crucial given that cancer care is a top healthcare cost globally. We know that patients who receive this type of care do better. 40% of those diagnosed with cancer are of working age, and a further 10% of our working population are taking on caregiving roles to their loved ones at their time of need. Of those diagnosed, 40% won't return to their previous lives and careers, with more than half wishing they had. Since launching our one-of-a-kind service back in 2016, we've supported thousands of people impacted by cancer in getting better health outcomes and returning to work. We've produced a number of clinical studies backing behavior change psychology as a means to improve clinical outcomes. 33% of participants report an improvement in pain. Not only that, but we've proven that participants return to work up to 17 weeks sooner than they might have otherwise. Welcome to Osara Health. We're creating a better experience for people impacted by cancer whilst reducing costs for individuals, employers, and insurers globally. We're confident that our approach to healthcare is both holistic and patient-centric. Join us in transforming the care in cancer.
Hi, my name is Travis Rush. I'm the CEO and co-founder of Reperio Health. Our solution is a platform that allows for an at-home or an on-site health screening using a variety of medical devices that are already pre-approved and CLIA waived for home use that allows a user to do a screening on themselves or in front of a provider or the clinician who can do the screening on them. That data is then transmitted to a mobile device and then pushed to the cloud, and you have instant results that include your blood pressure, heart rate, and your BMI at relative fat mass. And then on the blood panel side, full lipid panel, which includes total cholesterol, HDLs, LDLs, triglycerides, and glucose, and soon we'll be adding A1C. Our superpower, it's about the people. I have an amazing team. My co-founder and I, they're lucky enough to put together this League of Justice, if I could call it that, of amazing engineers and product people and marketing people and customer support and warehouse management. And that's really our superpower. We've got an incredible team that can pivot on a dime and change focus or get something done at the drop of a hat, and that's what's going to make us blow this up. The reason we, I think, should win this award is the healthcare industry has been so focused on chronic care management for so long. We have finally taken it upon ourselves to be a preventive solution that is instant, that gets the results in people's hands immediately, and being able to take all the different versions of attempts at preventive care that have not worked, that are unreliable, that leave people kind of in the lurch while they're waiting for results to come back weeks later, where life has now moved on and now they're not interested in engaging in what happened with those data points from those results. And instead, we're bringing to the market a solution that is instantaneous. Results are in your hands immediately in the moment where you're engaged, and get you in touch with a medical professional right then to start talking about an action plan to get ahead of any problems before they become chronic.
Hello, here's Nordin Bukhari, founder and CEO at Nytia Labs. As you already know, some people are more exposed to chronic conditions than others because of their family history, their genetics, their diet, their environment, and many other factors. And let me remind you this, living with chronic conditions could be really frustrating and life-threatening, leading to an unhappy, anxious, and even depressive life. And for employers, falling to support those people could be really helpful to talent retention and productivity. That's exactly the reason why in North America combined, businesses lose every single year $547 billion to productivity because of chronic conditions. And here at Nytia Labs, under strict respect of data privacy and regulations, we use a perfect combination of machine learning and AI algorithms, well-established evidence-based models, and our unique data set. We spent 2 years collecting both clinical and scientific to predict the chronic conditions you are the most at risk at, and provide you personalized recommendations for you to maintain a healthy and productive life. And for your employees, we provide community health insights to guide them through their workplace wellness policy change to better support you. We also provide them measurable results so that they can see clearly the impact we're having on them. Winning this competition will help us accelerate the impact we will be having on our community and our economy overall.
Hi, my name is Raghav Sundaram. I'm the CEO of Plethy. Plethy Recoup solution enables injured workers to recover at home. Think non-surgical conservative care, surgical cases, including fractures, all the way to catastrophic cases. The solution has a sensor, an app, both in English and in Spanish, and a coach who personalizes the care and enables the injured worker to stay engaged in their program. All this leads to better outcomes and the injured worker returning back to work quicker, faster. We sell to large enterprise, self-insured enterprises and carriers. What's our superpower? Well, I'm not sure we have a superpower. We are very, very focused on injured worker engagement in their care program. It's a hard thing to do, as you can imagine, including them doing their home exercise programs. So we diligently work in making our app and our program simple. And also our coaches, we run a biopsychosocial program which takes psycholinguistics and profiles the injured worker on psychogenics and engages them the way they want to get engaged. Look, we understand recovery is not a straight line, and there are ups and downs and good days and bad hours. And our focus really is to get the injured worker engaged on their program. Why we should win the category? Hey, look, there are great companies in the category. All of them deserve to win. If we win, I think it really takes a message to self-insured and carriers to incorporate our program to enable injured workers to recover. Remember, these are folks with access to care issues. We are talking about agricultural workers, heavy machinery, oil and natural gas, mining and so on, right? And so it takes a good message into the platform. Thank you very much for the opportunity. Bye.
In the United States today, almost 80% of the population has overweight or obesity. This number is really staggering. Thanks to medical advances in our field of obesity medicine, we can now help people lose over 15% of their body weight, an amount of weight that dramatically improves weight-related health complications. Only 7% at most of the population receives care according to medical guidelines, though, because of two reasons. One, there are not enough trained providers in obesity medicine, and two, obesity is really difficult and can be expensive to treat. At Intellihealth, we're solving this problem with our software platform, Evolve, and our clinical services, Flight Medical. And we're doing this in a way that ensures the highest level of medical care without exorbitant costs to employers. What is our superpower? Our team of the best medical obesity experts with deep expertise in every medication in our armamentarium, not just the expensive GLP-1s, combined with our award-winning software, which allow us to deliver the highest level of compassionate and effective individualized care in order to help our patients achieve significant, sustained, and cost-effective results. Why should we win? Because our medical solution is transforming employee wellness.
Physical therapy is a powerful service to drive recovery and improve outcomes. Historically, access to your expert care was limited to in-person visits only, but not anymore. Introducing IncludeHealth, a next-generation digital platform that extends, not replaces, your in-person care into patients' homes. Our HIPAA-compliant and FDA-registered platform was meticulously built to provide a secure and seamless connection between you and your patient, regardless of location. Powered by the latest in computer vision, our platform delivers interactive home exercises and remote monitoring directly through your patient's own devices. Compatible with patients' phones, tablets, and laptops, we provide interactive exercises with objective data collection to measure patient progress and help them achieve their recovery goals. No sensors, downloads, or passwords required. To start, our digital plan builder lets you create tailored plans specific to your patient's needs. Choose from a library of pre-built templates or build custom plans with a wide variety of exercises, functional tests, and surveys. Once saved, a text or email is automatically sent to your patient with a link to access their plan. To begin, patients click the link and their care plan is instantly accessed via their web browser. Their plan is then delivered step by step with real-time feedback, helping them progress on their road to recovery. Once complete, a report is automatically generated with objective data and analytics for your review. You can review your patient's adherence and outcomes from a single session, or track their progress over time. Adjustments to their plan can then be easily made based on their performance to help maximize their recovery. As a powerful extension of your in-person care, our platform can be utilized in remote therapeutic monitoring, value-based care, or even in direct-to-consumer initiatives. Most importantly, your patients now have access to your care anytime, anywhere on their road to recovery. IncludeHealth, extending your care beyond the clinic.